These are our individual hepatocytes. Yes. And at the peripheral portion, you can see the vein, artery, and the duct. Here you can see vein, then artery, and then here is our duct. So you can remember the mnemonic vein, artery, duct. These are our portal triad. Yes, portal triad, which is made by our portal vein, or better to say portal venule, artery, that is our hepatic artery, better to say hepatic arteriole, and there is a duct, better to say bile duct or ductule. Okay, here again the different VAD are located, vein, artery, duct. Now see here, the portal vein is giving the blood, and in between our hepatocytes, yes sir, these are our hepatocytes which are making hepatic cords. ओके, अब दो हिपेटोसाइट के बीच में आपको स्पेस दिख रहा है वेयर द वेन इज फ्लोइंग, वेनस ब्लड इज फ्लोइंग. दिस इज आवर sinusoid, the space between the two hepatic cords, and these bloods are coming from the vein also and the arteriole also. Remember, liver की blood supply portal vein or portal venule, it is giving 80% blood, MCQ from the your ganon, while the hepatic artery or arteriole is giving only 20% of the blood, MCQ. So main blood supply to the liver is portal vein, not the hepatic artery. Now these are mixing together and they are reaching into our central vein. So this is our central vein. Getting the point? But little more detail we are going to cover. See here, when you will observe the histology portion, in such situation you will observe the presentation of the liver in such kind of the way. Okay, so अब जब हम पैथोलॉजी में देखेंगे तो कैसा अपीयर होगा. सी हियर, this will be the appearance. Fine. So you can see our hexagonal or polygonal hepatic lobule. This is our hepatic lobule. इसके सेंटर में जो पोर्शन दिख रहा है, डेफिनेटली दिस इज आवर जोन ऑफ द central vein. Okay, and on the peripheral portion, can you see this all the area? Here is the location. Yes, look at this portion. These all are the location of the portal triad. Okay, but little more detail now we are going to cover. Yes, see here the different zones. Now we are entering into the zone classification. That was our hepatic lobule. Okay, but now look at the more detailed portion. Yes, see here, there are the different types of the theory to understand properly the structure and the function of the liver. Can you see one diagram where at the center you are looking the central vein, where the hepatic venules are opening, portal veins are opening, hepatic arteries, this all the blood are getting mixed. Okay, yes, you can see there are the hepatocytes which are arranged in the cord like fashion. So these are the hepatic cord, and the space between the two hepatic cords, they are our sinusoids. Okay, so try to understand the area around the our portal triad. That area is known as periportal area, zone 1, and the area which is around the our central vein, that is known as centrilobular area, area 3, and in between them there is the zone known as mid-zonal area number 2. And you can see at the periphery there is location of the our portal vein. This RBC containing structure is the artery, and this our rounded nucleus. Recall our histology concept. Rounded nucleus, they are mainly showing the cuboidal epithelium, and cuboidal epithelium they are found in the our bile duct. So this is the our duct. Okay. For the more better understanding, see here we had learned that our hexagonal hepatic lobules are in such kind of the pattern. Fine. Agree? Yes, sir. Now, here is location of our portal triad, where you will see the, yes, portal vein, hepatic artery, and the bile duct. Getting the point? Fine. Yes, sir. And at the center of each, there is our central vein. Yes, sir. These are the central vein of the each hepatic lobule. There are our many kind of the hepatocytes. Okay, so I'm just drawing the hepatocytes. Few hepatocytes. Yes, sir. These are our hepatocytes. Diagrammatic presentation. And the space between the hepatocytes, they are sinusoids. They are not, the sinusoids are not with too much space. They are very narrow. Okay, just diagrammatic presentation. So try to understand our different structures. This is central vein. Here is our hepatic cords made by the our hepatocytes. Okay, and here you can observe our portal triad. Getting the point? Okay, so try to understand the area around this portal triad. This is the zone 1 area around this our zone 1, that is a zone 2, this blue color structure. Okay, and area around this zone 2, see here, which is around the central vein. Yes, it is reaching, it is covering our central vein area. This is our zone 3. Okay, so what you can capture from here, yes, see here, this is our जोन 1. ये इंपॉर्टेंट है क्योंकि कई सारे एमसीक्यू आपके आएंगे, जैसे कि जब कोई टॉक्सिन इंजरी होती तो जोन 1, जोन 2, जोन 3 कौन पहले इन्वॉल्व होता है, जब इस्चेमिया होता है तो कौन सा एरिया पहले इन्वॉल्व होता है. मेनी क्वेश्चन यू विल सी. सो दिस इज द जोन 1, then here is our zone 2, and then here around the central vein that will be zone 3. तो बहुत बढ़िया हम मेडिसिन का और पैथो का क्वेश्चन करने जा रहे हैं. कैन यू टेल मी if there is the ischemia, then which zone will be involved first? Four option: zone 1, zone 2, zone 3, zone none. Okay, so try to understand what is your answer. Yes, see here, question from the patho and the medicine. The portal vein, artery and the duct, they are here. Okay sir. So blood is flowing from here towards the central vein. Okay sir. अगर मान लो लीवर में नेक्रोसिस हुआ, इस्चेमिया हुआ, तो ब्लड सप्लाई यहां से पेरिफेरल साइड में कम होगी, तो ब्लड सप्लाई कहां पहुंचती है, ब्लड इज रीचिंग टू द सेंट्रल वेन एरिया. ओके, यस, ब्लड इज रीचिंग टू द सेंट्रल वेन एरिया. तो ब्लड यहां से बहना चालू होता है. सो द मैक्सिमम ब्लड विल बी हियर, देन इट इज डिक्रीजिंग 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 एंड वेरी लेस ब्लड एट दिस our around the central lobe. So this is the MCQ. Central vein area will get chances most commonly for the necrosis. So this is our centrilobular necrosis. Important. So what you have to remember, zone 3, it is most common zone involved in ischemia or necrosis, MCQ, and that will be known as सेंट्री लोब्यूलर, क्योंकि हिपैटिक लोब्यूल का सेंटर वाला पोर्शन इन्वॉल्व हो रहा है. सो दिस इज अवर सेंट्री लोब्यूलर नेक्रोसिस. इंपॉर्टेंट. नाउ ट्राई टू अंडरस्टैंड. अगर किसी ने जहर खा लिया, लीवर में टॉक्सिन पहुंचा, तो टॉक्सिन के कारण लीवर में सबसे ज्यादा इंजुरी कहां पर होगी? यस, जोन 3 में, जोन 1 में, या फिर जोन 2 में. सो रिमेंबर, if any kind of the hepatotoxin, either there are the different kind of toxin we'll study, chloroform, okay, and many hepatotoxin. सबसे ज्यादा ब्लड सप्लाई वेन आर्टरी डक्ट से हो रही है, वेन आर्टरी से हो रही है. सो हियर द मोस्ट कॉमन, मोस्ट concentration will lie here. So it will affect this our periportal area. What you have to remember? Zone 1, it is our most common zone involved in hepatotoxin or any kind of the toxin. So these are the two very important questions. Fine. So try to understand the same thing. There are the three zones: central vein, yes, and this injury around the our portal tract, that will be known as periportal injury. What you can say? Periportal injury. Okay. So what you have to remember, that there are the damage to the different kind of the structure, zone 1, zone 2, zone 3, this all. Here there is a more detailed diagram. जब हम लीवर का माइक्रोस्कोपिक व्यू बड़ा करते हैं तो हम देखते हैं, yes, there are the different hepatocytes, yes sir, and then these hepatocytes are arranging in the cord like structure known as the hepatic cord. Okay sir, there are the two hepatic cords are shown, and in between the two hepatic cords, can you see there is the space? This space is nothing, this space where the blood is flowing, that is known as a sinusoid. Yes. Now try to understand. These sinusoids are lined by our endothelial cells. Definitely sinusoids are lined by our flat squamous epithelium known as the endothelial cells. Getting the point? Now try to understand again the space between our hepatocyte or hepatic cord and the sinusoid. This space is known as, see here, space of Desai. Many frequently asked question, not only from the anatomy but from the pathology also. So this is your important question. Remember the space of Desai. Okay. So here is our space of Desai. Okay.